Hello, my name is Mike Rohde, and this is my FHIR demo for the Intro to Health Informatics course at Georgia Tech. This is my 8th class in the program, and I'm pursuing the Interactive Intelligence specialization. This course is an elective under that specialization, and that's the primary reason I'm taking the course, although there's other reasons as well. I'm interested in U.S. health policy, so it's a good fit in that regard. And I don't know anything at all about health IT, so I'm bound to learn something, obviously. I live in Milwaukee, Wisconsin, but tonight I come to you from Dallas, Texas. Alright, let's get started. FHIR stands for Fast Healthcare Interoperability Resources. It's a specification for both data and an API for sharing electronic health records. It uses a RESTful style approach where you can use either XML or JSON, and it uses standard web technology. The use of standard web technology is a benefit because it can get programmers more interested in it and others as well. And if all the different systems agree to use the same specification, it makes interoperability much easier than if something proprietary was used. The data is represented by resources. Here's an example of starting to search through the patient resource. You can search by birth date, gender, or some other attributes, such as first and last name. You can use the green button to add different search parameters, and you can also sort the results or limit the number of records that are returned. Here's how to configure the search parameters in order to search for Marla Dixon. Here's the JSON bundle that was returned after searching the patient resource for Marla Dixon. It has some personal information about her, and importantly it has an ID, 523050. We can use that ID to search for the Marla Dixon patient resource when it's linked to other resources. Here are the search parameters for the condition resource. The condition resource provides data for different conditions that a patient may have and been diagnosed with at different encounters with a health professional. Here's how we can bring up the condition resources associated with just Marla Dixon using her ID. Marla Dixon has 4 conditions. Here are the search conditions for an encounter resource. An encounter is basically an appointment with a health professional such as a physician. Using Marla Dixon's ID, I was able to search just for Marla Dixon's encounters. She has 3 encounters with Dr. Bronstein. Here are Marla Dixon's medication orders or prescriptions. She has 3 of them. Here's one of Marla Dixon's 27 observations. Current usage of FHIR. This is from Lecture 1 of the course. There's the Argonaut project. That's an attempt to create a first-generation FHIR-based API and core data services specification. The federal government keeps mentioning the need for API-based data sharing, but they don't mention FHIR by name, even though FHIR is really the primary contender at the time. Major enterprise health software vendors are creating FHIR APIs in their systems, such as Epic Systems. There's been some recruitment for a future FHIR App Store. And then the Smart on FHIR platform was developed by Boston Children's Hospital. And that provides open specifications and some features that can be used to integrate apps with all kinds of different health IT systems. It's got REST APIs for structured way to get at the data. It's got some other features such as simple sign-on, and it can also integrate the UI from the web browser, the web app within the web browser, to apps in other systems. So it all looks like it's part of the same app, or at least it integrates in such a way that you can access it from the web browser. Alright, now how does this all relate to MU Stage 3? Well, Stage 3 requires that the patient be able to access their health information via an API, and obviously FHIR being the primary contender could quite well most likely would be that API. Main reason for this is because they're hoping that by providing an API access to the health data, all kinds of different software companies could create better applications to get at it than the patient portals that might exist already.